I'm based in north central London. So in a practice in Colindale, I'm a partner there. And my interest in diabetes started because, well, one, I'm South Asian, I'm Gujarati. So I know many people living with diabetes, including family members of my own, but also many of my patients. Um, and also I'm aware, as being someone who's South Asian, who has a family history of diabetes, I myself am also at very high risk of diabetes. So anyone from communities of ethnic origin have a higher risk of developing it earlier in our lives, and also at higher risk of developing the complications of diabetes as well. So for all of those reasons, it was a very relevant condition that I wanted to specialize in. So I have many areas of interest in diabetes, and in particular, type 2 diabetes. 90% of the country in the UK of people who have diabetes have type 2 diabetes, and that's what I'm going to be focusing today on my talk. And my area of interest is really how we can, at a very early stage in the condition, make a difference. And we're going to be talking about what areas of the condition can we really make a difference in. So that's really my main interest, how to make a difference in the early stages of diabetes, but also at later stages in diabetes, how do we avoid the complications of diabetes? So those are my two main areas of interest. Now, just a bit of a background. So we know that in the UK, there are about 4 million people who have diabetes. However, there are still about 1 million people who are unaware of their diagnosis. So if you have anyone in your family who you know has a family history of type 2 diabetes, somebody else in the family who has type 2 diabetes, it's really important that we encourage them to see their GP, to get tested for diabetes, because that link is certainly there. And there are many people in the UK who are unaware of their diagnosis right now. And we know that as we're emerging from the COVID-19 pandemic, this has had a massive impact on the way in which we all access healthcare in the UK and across the world. But the NHS has obviously been under a lot of strain in the last 15 months, and all of us have been impacted by that. Those who work in the NHS have been impacted because it's been a very pressurized situation, and people, members of the public trying to access the NHS have also sometimes struggled as well because the pressures that the pandemic has created on the services. So what we now find ourselves 15 to 16 months on through the pandemic is that many people with diabetes have not had their annual review. They've not been able to access their GPs in certain situations. They may not have had their blood tests. And this is an issue because we know that when we're not having reviews of our condition, sometimes the conditions can get worse. And that's certainly something that we started to notice with people who have type 2 diabetes in particular. Because they've not been undergoing their annual reviews, maybe their condition is worse. Now, what do I mean when I say their condition is worse? Well, it could mean that their glucose levels have increased. It could mean that their blood pressure levels have increased. It could also mean that their weight has increased as well. I know myself, during the pandemic, I wasn't able to exercise as much, and often I was eating more. I was eating some unhealthy things as well, especially early on in the pandemic, when I was stressed and worried about what everything meant as part of the pandemic. So we know that people's weights have increased as well. So glucose, blood pressure, weight, cholesterol, these are all things that perhaps have increased in patients who have diabetes during the pandemic. And that is a concern, because if we're not keeping on top of that, that is what can lead to the complications of diabetes. So this is something which is really important as we're emerging from the pandemic, that I highly encourage anyone who has any chronic condition, but diabetes in particular, re-engages with their GP surgery, to phone them up. All GP surgeries are open, they're accepting phone calls, they're accepting people, and now they're actually accepting more people to come into the practice as well. And I highly encourage people to get back into that routine of monitoring, having reviews, having their medicines looked at again as well. So that's really, really, really important for everyone to do. So what are the aims of treating diabetes? So we often talk about sugar or glucose, and sometimes, and actually for many years, even healthcare professionals were very focused on sugar, glucose levels, blood test results for HbA1c, which is an average of glucose levels over 3 months. But that's not the only thing that we should be looking at in diabetes, because actually what we're trying to do is prevent the complications of diabetes. That's what affects people. If someone has a high glucose level, that's not going to give them any immediate kind of disadvantage. But over the years, the collection of different things, complications within diabetes, can lead to poorer outcomes. So things such as heart disease, stroke, problems with the blood circulation to the hands and the feet, problems with the kidneys as well. These are really major issues in diabetes, and that's what we're actually trying to manage when someone has type 2 diabetes. We're not really trying to say we need to get their sugar levels, their glucose levels under control right away. In fact, that would be very helpful, but ultimately what we're trying to do is to avoid those complications, because things like heart disease are very strongly associated with type 2 diabetes. In fact, if someone has type 2 diabetes, they're twice as likely to suffer from heart disease. And unfortunately, heart disease reduces the life expectancy of many people with type 2 diabetes as well by many years. So this is one of our main objectives of managing type 2 diabetes. Now, that comes as a surprise to many patients, because we often talk so much about sugar and glucose and how much is my sugar level and how much was my blood test showing. But actually, what we're ultimately trying to do is avoid heart attacks. We're trying to avoid strokes, kidney complications from diabetes. But also, we're trying to avoid some of the other complications, such as eye disease, such as foot disease as well. So there are a variety of things. Now, how do we manage all these things? Well, one of the important things is glucose, so we can't ignore glucose, because we know that if our glucose levels are under control, then we can avoid some of those complications. But there are other things as well. Weight is one of the most important things to consider in diabetes. So we know that people who are able to lose a significant amount of weight, especially soon after they're diagnosed with diabetes, in some cases, they can reverse their diabetes, which is amazing, which is brilliant. But not everyone can do that. Not everyone is able to do that. But still, losing a proportion of weight, be it 5%, be it 10% of your body weight, over a course of a few months, can have a massive impact on reducing the risk of certain complications from diabetes. So it's not only glucose, it's also weight management as well. And then we also have to think about blood pressure, because the higher someone's blood pressure is when they have diabetes, the greater their risk of heart disease, of stroke. So again, managing blood pressure is really important as well. And then some of the other things to remember is smoking, because smoking not only increases the risk in patients with diabetes of having heart disease, but also of having foot problems as well and other circulation issues. So there's a lot there, and sometimes it can become quite overwhelming for people who have diabetes. There's so many different things they have to think about. But I think one of the most important things is to engage with your GP, with your local nurse, with your local specialist, and make a plan of what is important for you. For some people, what is most important is their weight, for example, and they'll feel happier if they lose some weight, and if they're looking better and feeling better, that is their most important thing. And that's fine. And so you need to ensure that that is what your plan is with your GP. For other people, they just want to make sure that their diabetes doesn't interfere with their job. You know, there are many people who are taxi drivers, for example, or have other types of jobs where having erratic blood glucose levels can cause a real issue. And so in those situations, the GP and your nurse can make your diabetes plan focused on that element of things. So it's really important to ensure that your diabetes management is tailored to your lifestyle and what is important for you and for the complications that you want to try and avoid. So I'm just going to finish off on one area about medications, diabetes medications. Now, nobody likes taking medicines. I appreciate that. I'm the same myself. But we know that losing weight, exercising, dieting can only go so far. And for many people, it is difficult to do that. I know myself, it's very difficult to maintain those sorts of measures over time. So that's where medications can come in. And the early use of medicines, so not delaying it and waiting for many years, but using medications at an earlier stage in your diabetes condition can actually help get control at an earlier stage and avoid complications. So diabetes medicines now not only reduce glucose levels, but there are some diabetes medicines that can help you reduce weight and can also reduce your risk of heart disease, stroke, heart failure, and kidney complications as well. So I highly encourage anyone who has type 2 diabetes to have a review of their medicines with their GP and to ask their GP, what are my medicines doing for me? More than just controlling my glucose, what other benefits am I getting from my medicines? And it's important to have that conversation with your GP and your nurse at least once or twice a year to make sure the medicines you're receiving are actually giving you multiple benefits, because there are several newer medicines now available that do more than just reduce glucose, that can help with your weight management and your risk for heart disease. So that really is all I wanted to cover today. I've just given you a flavor of a few things that I feel are important. I hope this brief session has been useful to you.